Everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jargos. Today, I'll be doing the second part of one-sided disease of an external kind, that is local maladies. Just to recap the classification of one-sided disease. One-sided disease divided into two main parts, internal kind and external kind. Then external kind again divided into physical and mental. Physical further subdivided into local maladies or surgical disease and surgical disease, then and local disease, and mentals are divided again into the mental disease. So today we'll see something about local maladies. So please remember, local maladies and local diseases, they are not the same. It has a subtle difference between local maladies and local diseases. Now, what is this difference? As we go further in this video, it will become clear to you. So please remember, it is not the same. In most of the colleges, it is taught that it is the same, but however, it is not. So, one-sided disease of an external kind, that is local maladies. It is given after number 185 to 187. So local maladies are those which appear on the external parts of the body. Even local diseases are one which appears on the external part of the body. That is why in most of the colleges, it has been taught that local maladies and local diseases are the same, but it is not so. Why? We shall see. The old school believed that these parts were alone morbidly affected and that the rest of the body did not participate in the disease. So Dr. Hahnemann said, with reference to the old school, that they believed that only a specific part, specific location, or a specific organ was affected, or a specific local part was affected, to be more precise with local maladies, and the rest of the body did not participate in the disease. This was a theoretical, absurd doctrine which has led to the most disastrous medical treatment. So if you have this view in mind of the old school, that whatever local part was in a disease condition, only that has been affected, the rest of the body is not involved. So this theory or this hypothesis or this doctrine was totally false, and as a result of which, naturally, the medical treatment also given was wrong with disastrous results. So now let us see what are the criteria for local maladies. Number one, it should have been produced a short time previously. Second, it has to be an external lesion. And third, must be trivial in nature. So these are the important points for local maladies, that it should be produced a short time previously. It is produced by something of an external lesion. The cause lies external, and it is trivial in nature. So these are the three very important points of local maladies, which will help us to differentiate from local diseases. So in this video, I'm just focusing on local maladies. In the part 3, you will be getting the local disease. Since the cause is external and trivial in nature, the vital force does not sympathize with the rest of the body. So further, Dr. Hahnemann says that the local maladies are always caused by some external cause, and this external cause is very trivial in nature, and the main part is that the vital force does not sympathize with the rest of the body. Out here he says local applications are admissible. For example, frostbite, chilblains, superficial burns, etc. will come under the heading of local maladies. So let us just say a frostbite. So external lesion or an external cause is what? Excessive exposure to cold. And it has to be produced a short time previously, and it must be trivial in nature or must not be very serious in nature. So you're exposed to, say, excessive cold for a few minutes, and the lesion is trivial in nature. So the vital force does not sympathize with the body, and the patient still continues a good state of health, with the exception of a small part of the body which has been affected by the frostbite or the chilblain. So therefore, Since the vital force is not affected, local applications are admissible. So you can apply some local application in order to relieve the pain or the discomfort, whatever you are having. Furthermore, Dr. Hahnemann says something about surgical disease. It is mentioned in aphorism number 186. In the case of injuries occurring to the body from an external source, if they are severe, the whole living organism sympathizes. There occurs fever, etc. So he says that a local malady, the cause is external, trivial in nature, and a short time previously. And then he further goes that those diseases which require surgery are, number one, injuries occurring from an external source. And most important is that the whole living organism or the vital force sympathizes with the body and there occurs fever, etc. So the treatment of such disease is regulated to surgery. So naturally, if a certain problem is there with the patient which requires surgery, you do not expect to give the homeopathic medicine and cure the disease. So let us go further. It will become much more clear. This is right only this is right only in so far as the affected parts require mechanical aid, whereby the external obstacles to cure may be removed by mechanical means. So therefore, Dr. Hahnemann says that such diseases will be regulated to surgery only if the external parts require some mechanical aid. And this mechanical aid, when given, will remove the obstacle to cure. Now, let us see the example that will become much more clear. For example, Dr. Hahnemann has said reduction of dislocation. So suppose you had dislocated, for example, your shoulder joint. Do you expect to give the homeopathic medicine and do you expect the dislocation to be all right? Definitely not. You have to reduce the dislocation with the help of a surgeon or an orthopedic, and whatever pain, whatever discomfort then is occurring, then you can give the homeopathic remedy. Another example, bringing together the lips of the wounds by bandage. Or if you have a deep cut, it is bleeding profusely, do you expect to give homeopathic medicines and stop the bleeding? Definitely not. It requires some mechanical aid, for example, suturing. So you suture the lips of the wound or you tie a tight bandage around it in order to stop the bleeding. Extraction of foreign body that have penetrated into the living part. Similarly, for a foreign body also, the same procedure has to be followed. It has to be removed. Suppose you've got a foreign body in the eye. Do you again expect to give homeopathic medicine and say that the foreign body will come out from the eye? Definitely not. You have to treat the external cause, which is an obstacle, by referring the patient to an ophthalmologist. He will remove the foreign body, and afterwards, then you can give the homeopathic remedy because the vital force sympathizes with the body. There may occur pain, there may occur watering of the eyes, and so on and so forth. By making an opening into a cavity of the body in order to remove an irritating substance or to procure the evacuation of effusions or collection of fluids. So similarly, another example is given that if a fluid has collected in the body or if an effusion is there, you have to make an opening in the body in order to remove the irritating substance. Next example, by bringing into apposition the broken extremities of a fractured bone and retaining them in exact contact by an appropriate bandage, etc. So again, in the case of fracture, you again have to go to an orthopedic surgeon. He will reduce the fracture and he will bring it in proper apposition or in proper alignment, and he will plaster the part and give rest to the part. But when in such injuries, the whole living organism requires, as it always does, active dynamic aid to put it in a position to accomplish the work of healing. So besides this, taking care of the obstacle to cure, with these examples what I've given, the vital force naturally will sympathize with the body. There may occur fever, pain, irritation, so on and so forth, or different sensations, which has to be taken care by the active dynamic homeopathic medicine. Example, when the violent fever resulting from extensive contusions, lacerated muscles, tendons, and blood vessels require to be removed by medicines given internally. So a contusion is there, and you have then, with the help of surgery, you have lacerated or the lacerated muscles are there, or the contusion is there, you have sutured it and you have brought the gaping wound or the lips of the gaping wound in opposition to each other properly. And then the patient suffers from violent fever. So in such instances, after the mechanical aid has been given, when the vital force sympathizes with the patient and occurs fever, that is the time we have to give active dynamic aid. Or when the external pain of scalded or burnt parts need to be homeopathically subdued, then the services of a dynamic physician and his helpful homeopathy comes into requisition. So that's all for this video. It's a short video, but the concept of local maladies should be very clear, because there's a definite difference between local maladies and local disease. So the part 3 will be dealing with the local disease, and there again I will differentiate, if you still haven't understood from this video, what is the difference between the local malady and local disease. So there's a subtle difference, and there's definitely a difference. It is not the same. So thank you very much for the patient listening. Part 3 will be coming up soon.